Hi, I'm Samir, clinical program specialist for Giant Pharmacy.
And I am Sabrina Avery, mother of 4.
Hey, thanks for joining us.
Thank you for having me.
Glad to have you.
Want to tap into this wealth of knowledge that you have.
I'm happy to share.
Okay.
So as you know, it is flu season.
It is.
We've covered so many points along this. We've encouraged people and recommended that they get their flu shot.
Yes.
We've given recommendations on how to do better hand washing techniques and just overall hygiene tactics to help reduce transmission of viruses and bacteria.
Check, check, check.
All right. And now what happens? You get the flu.
I got the flu.
All right. It happens. So as I had mentioned earlier, you got the flu shot, you've improved your hand washing technique and also just overall hygiene practices, and you still got the flu. Thing is, I had mentioned earlier that getting the flu shot does help protect you against the flu. However, if you got the flu and still got the flu shot, it's possible that A, you already had the flu, which happens,
Yep.
or B, that you contracted a strain of the virus that is not covered by the quadrivalent or 4 viruses that the flu shot protects you against.
Okay. So we got the 5th one.
Okay.
Okay. The one
Of course.
that I didn't
You
get
would.
the shot, right?
You would, yes.
I would, get the 5th one.
Yeah.
So do I go to my doctor? Because I know that like for everything, do I need antibiotics?
You don't need antibiotics.
Come on, they cure everything.
I know, that is where everybody goes. They just say, just give me a Z-Pack or give me amoxicillin.
I like the 10-day.
Oh.
I need the 10-day.
You know, that's great if you've got a bacterial ear infection. However, when you get the flu, it is caused by a virus. So unfortunately, we can't give you antibiotics. That was not going to help with anything. But what we can do is, if you get to the doctor within 48 hours of experiencing your symptoms, there are some options that you have.
How does he know?
So it's by a swab test. They can confirm that you have the flu or not.
Okay.
And from there, they can prescribe a medication to you that'll help shorten the duration of the symptoms as well as the severity of the symptoms. And remember that if you test positive for flu, we've got to prophylaxisly treat everybody else in your family.
What does
Okay. So what it means is that to protect you now, even though you don't have the flu, because you live in close quarters with somebody else who does, the likelihood of transmission and you contracting it as well is increased. So we want to just go ahead and protect you as well. So all of our giant pharmacies, DC, Maryland, Virginia, Delaware, have it in stock and ready to dispense it. And remember that it does also come in different formulations.
Right.
So for your pediatric patients that have trouble swallowing, we do have the liquid formula as well.
Can you flavor it or is it gross?
We can do every flavor. It's funny that you ask. Do your kids like tuna flavored stuff?
Only in a sandwich.
Well, we can do tuna flavored medication. We can also do blackberry, cherry, cater to your needs. We're able to do it. I got to double check on those specific medications. However, I'm quite confident we've got the flavor for you guys.
Grape is going to be a safe bet.
I think we should be good.
Okay, good. Awesome. So you keep talking about symptoms, like flu symptoms. What are the flu symptoms?
So the main thing that kind of differentiates between having the flu and a regular cold is going to be the chills, the body aches, and the fever. With that, the best way to combat that is over-the-counter medications. Our pharmacists in our stores are a wealth of knowledge and very much so able to help guide you down the aisle and find the medications that best fit your needs and to treat your symptoms. With that being said, I always recommend acetaminophen. That has been proven to be the most effective fever reducer. However, sometimes when you are really, really not well and not feeling good at all, you may need to cut the fever a separate way. You can use ibuprofen and alternate those doses as well. But the main important thing is remember that your body is kind of overheating to help kill this foreign pathogen that's in you. So a lot of the symptoms that are associated with the flu are also associated with dehydration. So staying hydrated is so important. I always recommend patients go ahead and get some Pedialyte because when you're not feeling well, drinking, eating, everything hurts. I mean, I've heard of patients saying their fingertips were in pain.
Oh my gosh, I've heard that too.
Yeah, so just imagine lifting a fork and trying. I mean, I know it's tough. I always just tell patients if there's that whole feed the cold, starve the flu. Feed the flu. I don't even know. Yeah, it gets weird. Just eat. I mean, we talk. You can always see your nutritionist, and they always have recommendations for those immune boosting foods as well.
Yeah,
however,
definitely.
you need to eat bananas, rice, applesauce, toast, something simple, just to keep your gut stimulated and to help absorb any toxins as well.
Oh, it makes a lot of sense.
Yeah, I mean, there's so many. It's so important that you treat all your symptoms, and the whole point is to get you back to work, to school, regular life, because I know that the flu can really put you out. So protecting yourself is so important. important. You can always reach out to your local Giant pharmacist, whether, I've had people call me, I've had people email me, fax me, send a pigeon.
People still fax?
Yes, they do. Yeah,
Okay,
not just
all right.
electronically, they do. But there's so many means by which to reach out to your local Giant pharmacist. You can also reach out to them at pharmacy@giantfood.com. So we're always there for our community, and we are always happy to educate people that are members of that.
I think it's great. Thank you, Samir, for everything that you do.
No, thank you. If you'd like more information about Giant Pharmacy, please visit us at our website at giantfood.com and click on the Pharmacy tab.